Hey guys, welcome to this episode of Hop Hop Podcast. I'm joined today by the awesome guys over from Matrix Dental Specialists in South Africa. We have Imran on the top right, we have Ridwan on the bottom right, and bottom left we have Fahim. You can see their Instagram handles, so if you want to follow these guys, make sure to head over to Instagram and follow them on Instagram. And yeah, so welcome guys. Today I thought we were going to have kind of a great conversation. The main things we're going to talk about for everyone listening is going to be the complications of specializing, or maybe the challenges you might say of specializing. We're also going to talk a little bit about opening your own practice. As we know, you guys have opened Matrix Dental Specialists in Cape Town, which has been doing really well, even though you opened just before the COVID crisis hit. And we'll also talk a little bit about managing the work-life balance, which is so important.
Oh, thanks for having us.
No, you're welcome, guys. So just a quick shout out to the guys who are watching. If there's any audio issues, let me know. Sometimes we have a little bit of background noise and stuff, and I'll try and sort that out for you guys. Um, let's have a quick introduction for everyone watching. If anyone doesn't know who you are, should we start with Imran on the top right?
Also, I'm Imran, right? I've qualified in 2011 at University of Western Cape. And then after that day, I did a postgraduate diploma in interceptive orthodontics. After that, I became Invisalign certified, and yes, I've been working as a general dentist since. And then I've been working as a locum ever since I qualified. My wife and I opened up a practice about 6 years ago. And then I decided to join the guys with this one.
Is your wife a dentist as well?
Yes, my wife's also a dentist.
So we kept within the healthcare realm. Yeah, it's funny because I'm the one dentist from the rest of my family, the doctors in both my brothers and my parents are both doctors. So I'm the black sheep.
So actual doctors.
Yeah, they think they're saving lives and stuff, but Ridwan, should we dive into just a quick introduction about what you're about?
Yes. I don't know what I'm about. Also, I qualified at Western Cape with Imran in 2011, and then I worked for a little bit, and then I went to specialize in prosthodontics in 2015, and that's pretty much what I spent the last 4 to 5 years of my life doing. Yeah, I think we'll go more into that as we chat, but yeah, I think that's
and just with prosthodontics, we want to kind of clarify: do you just do dentures, or do you do the real stuff as well?
Let the guys laugh, and then when the ego has been inflated enough, I'll pop it. You done? Okay. The most important person in this conversation is me. but yeah, I think with the guys overseas, the simple thing is that in South Africa, prosthodontics encompasses both fixed, removable, as well as endodontics. So we don't have the speciality of endodontics or implantology or whatever it may be. It's in essence specialized restorative dentistry. And then Imran realized he just got owned.
Now you see, when you don't like seeing kids and you go into prosthodontist and you call yourself a super dentist.
Pretty much.
Yeah, because to be honest, the definition changes from country to country what they do. So I am taking the mick a little bit, but it is an important thing to kind of know.
Yeah.
And last but not least, we have Mr. Perio Vision down the bottom left. Tell us a little bit about yourself, Fahim.
Hi, I'm Fahim. I've graduated from university a bit earlier than these two guys. So I qualified in 2008, and my intention was to become a maxillofacial surgeon, which I spent the next 6 years trying to. So a few exams, working as an associate, volunteering at the maxillofacial units in Johannesburg, doing postgraduate diplomas in implantology and oral surgery and the advanced trauma life support and those type of courses. And it was during that period of learning and being interested in implantology, where you realize that, periodontics actually has the better end of the deal. In South
Yeah.
Africa, especially, periodontists receive training as part of their major training in periodontics. And the difference between periodontics in South Africa versus some other places in the world is that it is a combined course with 3 majors. So we got oral medicine, periodontics, as well as implantology. And it's a 4-year degree. And I completed it in 2017 and then waited for Ridwan because I needed a partner to open up all this stuff. So, you can't go solo and you need a good team. And that's where we're at.
Yeah, I think that's really key. I think anyone who's worked in any practice will say, if you enjoy being around those guys who are in the building, then you don't feel like you're working too hard. And I think anyone who's been in the opposite position, where they may be not quite happy with the team or the people, which people clash sometimes, it can become a very lonely place. So it's really important to have guys who can have a bit of a laugh. Which I think we can already see we are having a bit of fun. We had a lot of fun last week, didn't we, when we had the planning meeting? It's a bit of a
something else. Fahim doesn't remember this, but this was my fanboy moment. Why are you laughing?
I know it.
When I was in first year dentistry, Fahim was in final year dentistry.
Right.
And in first years, you normally go and you observe what the final years do. And it was my first day of observing final years. And the guy that I had to go and observe was Fahimia. And Fahim doesn't remember this. When I got into the registrar program, I went up to Fahim and I was like, I assisted you in my first year dental school. And he just looked at me weirdly and he still doesn't remember. But, it's a big day in my life. It's the day that I wore shirt and tie and my white coat for the first time. And Fahim doesn't remember it.
God had a plan.
Oh dear. Yeah. Does he remember you now?
Still, I have no recollection of him or the tooth I removed.
It wasn't extractions, it was cons. It was on B-floor. I remember that day.
Yeah.
He remembers which tooth you were doing, how long it took you to remove the caries, He
Like one went home and wrote his diary, their diary to their house.
One made notes.
Guy, I don't remember his name.
How nice my anatomy was. And
then do you remember? Do you remember how many mils of anesthetic he used?
Not at all. Not at all.
As long as I know I was part of his inspiration, that's fine.
That's the most important thing, yeah.
It also shows how much older he is than what I am.
Yeah.
Are you the baby of the group then?
I think I'm the youngest, yeah.
Yeah.
Yeah, I'm the youngest.
Yeah, so should we dive in onto the specialty training, because I think that's what a few of the guys are definitely here for, and we'll bully each other later on, I'm sure. So Ridwan, let's start with you. I've seen a few of the bits of media you've done on YouTube. I searched all of you guys yesterday to find out what was going on. So you've done some media work in your last job, didn't you? With one particular video, which comes right at the top if you type in South Africa dentistry.
Wow.
So a lot of the stuff that you're talking about was really, really it made sense to me in that video, if you remember it.
I'm not sure which video you're talking about.
Probably the Neodent one.
Yeah, that was it.
Yeah, the Neodent. Yeah.
But you talked very briefly about the specialty you're doing why you took a specialty on. Can you explain the thought process where you were like, okay, I've done a bit of general dentistry, whether that was in your undergrad training, and you think I need to step up to that next level? What was that thought process for you?
Honestly, it wasn't a thought process. It kind of just happened organically. I think it was in my fourth year of dentistry, and I realized what kind of just came to me that I think I like the start of the dentistry, and I need to know more about it. And what's the one way of learning more about something was to specialize in it, and that's pretty much how it went. If I look back, I think it was part of my personality to end up in this direction, because just funny joke at home. When I was applying for high school, my dad still came to me and asked me, what type of high school I want to go to. And he still thought I should be in trade, whether it was building or architecture or something like that. Pretty much something hands-on. And I wasn't interested in any of that stuff. And when I look back now, I've kind of gone back to what my dad initially thought I would be doing, which is pretty much building and breaking. Uh, and I think eventually when I got into prosthodontics, the true joy of the work actually kicked in, because initially it was a more mechanical thing or a hobby that I thought I was pursuing as a career. And then when I realized the scope of practice, which encompassed not just teeth, it encompassed a lot of lifestyle factors, because obviously you end up dealing quite a bit with maxillofacial prosthodontics, you end up dealing with especially oncology trauma, and then your developmental anomalies. And suddenly you realize that life or the work that we're doing really is just beyond teeth. As a general dentist, you obviously have a similar type of passion by delivering that partial denture or the single crown, but when you eventually end up teaching a rehabilitation of someone that's been scarred for life, uh, I think that's pretty much what kept the juices flowing, and I think that's what keeps the drive going as well. So I think it's a bit of both. I think it's also very to something like surgery. You get a lot more involved with patients, uh, emotions and feelings, and that can be taxing, but I think it's fun. Depends on the personality, I guess.
Yeah, and it sounds like your the way pros is set up in South Africa, it is a little bit more all encompassing as opposed to maybe in the UK where you are very much more limited towards a more specific kind of treatment or kind of modality.
Mm. I think the more experienced guys have closed off their practices to this type of work, whether they would do removable or fixed.
Yeah.
But I think at my stage in career, I'm just kind of enjoying being exposed to as much as I can.
Yeah, sure. And I wouldn't take notice of me joking about removable pros because I just don't like it. That's the main thing.
Not many people like it, which is a good thing. It keeps us in business.
Yeah, if my patients are willing to travel, I'll send you them all. Don't worry.
I'll send the endos up to the UK.
Yeah,
I
sure.
think it's a fair swap.
um, Fahim, should we talk a little bit about your thought process with perio as well? Because again, encompassing oral med and kind of that side of things is very interesting. Um, and how did you make that decision? Did you guys have an idea that you three wanted to make a practice beforehand, and then you kind of picked a little bit before like that, or did it just fall in place as well?
So I actually never knew Imran or Ridwan until I I met Imran, I think 2 years ago. Yeah, about 2 years ago. And I met Ridwan. We became friends while doing my postgraduate.
Yeah.
But yeah, my story is not as inspired as Ridwan's, where things grew organically. I remember when I told my father I'm applying for dentistry, he looked at me with like, oh, weird. It's like, really, if you work hard, maybe you can get into dentistry, because I was quite playful as a youngster. And I got it, and I actually enjoyed all aspects of dentistry. And while studying undergraduate, I was very confused of what to actually focus on, because I enjoyed from restorative process, even pediatric dentistry and ortho. And initially I thought, okay, I'm going to become an orthodontist. I'll go for orthodontics because, they have an easy job and they make lots of money. But yeah, I found out, okay, no, it's a bit boring for me and my taste. And ideally, I think I would have liked to go into something which is a combination of implant and prosthetics together.
Yeah.
Obviously, it's not something available in South Africa. The oral med aspect, from those of you who are dentists and remember undergraduate, oral pathology was one of those subjects that caused a lot of anxiety. And yeah, initially it was a bit of a concern for me as well. I thought, how am I going to get through that? But once you start treating patients and seeing these things all the time, you realize it is a significant impact on their lives, their lifestyle, and basically their day-to-day comfort and confidence. And whether it's diagnosing and managing cancer patients, to patients with simple fibromas. It's very, I don't know, it's many of our patients that we see, they can't find assistance anywhere else. So they'll go to their GPs, they'll go to the dentist, and they don't really know what is going on. And for some of our patients, especially on the immunological disorders, they will go through many years before they actually find someone to treat them.
Yeah.
Like I've seen a cancer patient yesterday who's, I think for the past 3-4 months, was being treated for fungal infections by her doctors, and the dentist extracted 2 teeth. But all the while, there's a cancer growing. And she pitched that by me, and then you say, okay, you got this fungal infection, you're a relatively young person, you're healthy, there's no allergies. Now you have to think, why is such a person having this type of reaction?
Yeah.
And then why are they developing this type of... So once you go through the bloods and you look at CBCT and you go through the scans and you look at your clinical pictures and you realize, okay, no, this is high risk. And then, yeah, it's unfortunate that you find these lesions appearing too late in patients' lives. And the earlier we find them, the better it is in terms of survival.
Yeah,
So
for sure.
that's the exciting part about oral medicine. Every patient is like an investigation. And yeah, I think that is the more rewarding part of my job, even though it's technically it's the most challenging part.
Yeah.
And yeah, obviously I love surgery, so that's why I pursued periodontics. And I particularly like microsurgery, and they'll all make jokes about how I want to stitch and take my time and play with soft tissues. But yeah, I had to teach Imran how to teach how to stitch.
Really? Do you have a shaky hand, Imran? Can we just check? There we go. Speaking of Imran, obviously you're a general dentist, but you have done some Invisalign training. How do you see your role within the practice? Because we have the pros guy, we have the perio guy, and general dentistry it's a difficult thing to focus in on sometimes because you have to do a bit of everything, right? And know the limit of, okay, this is now something that needs to go to Ridwan or needs to go to Fahim. How do you manage that, and what kind of other training do you take on to get skilled up and stuff?
Okay, so basically how it would work here is, if a patient is not referred to them, they would come to me first. I would have a look and say, okay, what are they here for? What can I help them with? And obviously, I know my limitations as a general dentist. And the benefit of working with two skilled specialists like them is, if there's anything that I can't do, I wouldn't say, oh, I'm going to cowboy this thing and go for it. I have them to refer it to. It's not that I'm going to try something I know I can't do, or just try my luck or something like that. I know my limitations and I keep it to that. And I enjoy the ortho side of everything. So hopefully one day I'll also be an orthodontist, follow for Yim's original dream. But
so he's chasing the money, right?
No, I'm chasing an easy life.
And you've done Invisalign already, so we spoke to quite a few guys who are doing things like the smile makeovers. And Invisalign is a useful tool in that, but also there are other things out there. There's lingual, which can work really well. Incognito, have you heard of that? It's a brilliant system, which is taught by Stefan Decker, I think his name is, in London. Really clever guy. And obviously then you've got your classical ortho, train tracks on the buccal surfaces. So there's a big scope there, and it sounds like you guys have got a nice ecosystem working throughout the practice.
And from what I've heard when I talk to other specialists, is that those lingual, so they're not a fan of it. They find it very difficult. So I'm assuming that you've got your way, you've been trained in a certain way, and now reversing everything. So I think they had an issue with that there, but other people say it works fantastic. So I don't know much about it, so I can't comment about this.
it's interesting. I spoke to him really early doors in lockdown, and he said that he can get things to move within 3 months sometimes. You know, your upper
Wow.
arch especially. So I think there's definitely like it's a tool in the box.
Yeah.
You know, we want more and more tools, and that's something we spoke about last week. You know, having all the kit, all the gear, but you need to pick the right one, otherwise you get yourself in a real financial hole. So it's important to do that. So yeah, what were the challenges that you guys have found during specializing? Is there anything that ran kind of commonly? So Fahim and Ridwan, anything that you guys found that actually the same issues cropped up again and again, either before you are applying in that applying process or during the actual postgrad?
You start with it. You can start with Ridwan. He had an easier life. He spent far less time trying to get in than me.
Honestly, I think I was blessed. Like I think I'm really grateful for the journey that I walked on. Like I won't say it was an easy journey, but I think sometimes you just need the stars to align in a certain direction to just work in your favor. Um, I think the one thing that I would take away, that whether it was my journey or for him or anyone else that specialized with us, is that it is a lonely road. Uh, you obviously have people that support you and things like that, yeah, but fundamentally, I think there's a lot of willpower that comes from the individual, regardless. Because whether it's a month of studying or 5 years of trying to get into a program, it's still you and the dark ceiling at night thinking about these things to get in. So I think it's a lot of, yes, there's planning. You get some individuals that want to specialize and will say it, but just haven't actually even got as far as doing a diploma initially. Um, but I think fundamentally you're doing podcasts. You don't have an excuse. But so I think it's also about planning as well. And then fundamentally, the only way you can justify waiting or not getting at a certain time is leaving it up to the alignment of the stars. But you need to understand what are the prerequisites that you need to fulfill. And I think, especially in our South African context, people are going to easily pull the race card and say that there's a quota system and we need to give a certain demographic first preference, or you need to give us either males or females. I honestly don't buy into that philosophy. I think you do the best that you can, and when the time's right, you're going to get in. As long as
Yeah.
you're sitting there with the CV that you need, you're going to get in when the time's put out for you. Uh, if you look at Fahim, I think Fahim would have been a terrible maxillofacial surgeon because he's just a good periodontist. And I think he would have probably been a loss to periodontics if he ended up in maxillofacial surgery. So I think kind of just got to do you, and then eventually the stars will put you where you need to be. Yeah.
Fahim?
Fahim?
Yeah, so my journey was slightly different, obviously, and yeah, it took some time. So, like you said, get your CV in order. I had my CV in order quite a number of years ago. So, yeah, for some of us, it's a bit more challenging than others, and whether it is demographics or there is politics involved in South Africa as well. So I qualified. I graduated at the University of the Western Cape, and I'm originally from Johannesburg. So you're going to Johannesburg, applying in Johannesburg, and nobody in those universities knows who you are. And that's obviously one of the big challenges. So if you're applying to a university where no one is familiar with you, it gets a little bit more challenging.
Yeah.
And yeah, but what the journey did do for me is I got a lot more experience, both surgically with maxillofacial, helping and assisting and even treating patients in the department. And yeah, doing the postgraduate diploma at University of Pretoria. But that part of the journey, I think, makes me a better surgeon now because you know how basically the maxillofacial surgeons do it, and what they apply, and then yeah, you take it from a perio level.
Yeah, I think it's nice to get maybe start with a broader outlook and then narrow in a little bit. I think that's a really good way because then you have a bit of experience and knowledge on all these things. So even just to the patient, you sound more knowledgeable and they can have a bit more confidence in you
Yeah.
when you're speaking to them and things. So I think that's pretty good.
Well, the journey is a lot of sacrifice, as everyone says. I mean, my wife has sacrificed a lot. So yeah, it requires a lot of patience as well. And during that time, you're also not earning big money or doing anything of that sort.
Yeah.
And I think a lot of people who are trying to specialize, if money is what you're going for, then don't specialize because you're going to spend more time losing money and spending money than actually making money. And then once you are a specialist, you spend more money buying stuff that you need to practice your specialty.
Oh my God,
So
tell me about it, man. Tell me about it
yeah,
because uh, first of all, how's your Lamborghini, Imran?
Oh, it's beautiful. It's parked outside.
Uh, Yeah, no, because I mean, for myself, on top of doing, podcasts, I have a microscope sat downstairs, which I'm currently doing nothing with, until I get into my next job or whenever that's going to be. So there's so many things for an endo, for example, you want to be looking at. Microscope can cost you anywhere from 10 to 40 grand, and that's, maybe a year's salary sometimes. So it depends what you're looking at. So if anyone is watching out there thinking, oh, dentists are just raking it in, maybe by the time you're 50, 60, you are. Uh, but at that point, there's been a lot of hard work and struggles that's gone by the by. It's only Imran with his Lamborghini outside that's really rolling up the easy street.
I
I don't
think also
know.
the other thing,
Just by the way, I have
like,
a Polo, not a Lamborghini. If anyone thinks that I'm bad.
but also the other thing is, I think like specializing. If I look in hindsight, getting in early is obviously the ultimate goal. But if I think about getting in too young is also a problem. There's a lot of things about you as a clinician that you still need to learn, like
Yeah,
figuring your way around just clinical decisions and interacting with patients. And I think also in terms of life, there's a certain level of maturity that you need to have or you have to grow into very quickly. I think for me personally, maybe I got in a year too early, 2 years too earlier. Uh, but I think if you asked me this when I applied, I would have probably thought, said you're talking shit. But I think there's a lot of time management balancing that needs to be done, and that I think only age actually gives you that. So, and maybe it's not a bad thing to take a few extra years before you get into specializing.
yeah, yeah. Well, yeah, I think that's true. For myself, I've been practicing 18 months, maybe just coming to 2 years, and I'm looking now at the point of, okay, in the next year, maybe 2 years, I'm gonna apply to the specialty training. I think if I had gone in any earlier, I wouldn't be able to put a matrix band around a tooth, or do certain things, um, put a rubber dam on properly. All these things that you might want to be doing if you are an endodontist. You still need a very strong restorative background or foundation before you decide you can get into a root canal.
Mm. I think also another thing is forget the clinical component. In advanced prosthodontics, you're doing treatment plans that can cost patients in a South African context sometimes 200, 300,000 rand. And your patients are sitting in the age of 50 or 60. As a
Mm.
31-year-old, you need to tell someone that they're going to spend this kind of money, and you have to be prepared that there's going to be a patient that's going to look at you and say, "You are younger than my youngest son, and you're asking for this kind of money." So I think that just that interaction and speaking to patients and being able to speak to them on a certain level, that in itself takes time. And
Yeah,
I think to be learning that in private practice when you have bills to pay is probably not the time to be learning it.
yeah, yeah. Which is why
Yeah.
Imran's grown a beard as well, so you can just see him a little bit
Just
more.
look older, yeah, more mature.
Yeah.
That's
And the
Yeah.
gray hair.
Has he dyed it in the grey hair?
It's all natural.
Oh, it's natural.
That's
All
You didn't
natural.
you didn't add in
He'll do
that's
the
all
yourself with a
wigs for
little bit
you
dentistry.
of.
one day.
That's all dentistry.
Yeah, I had a grey hair. I think during my finals, I started having some in my beard, and I panicked and just shaved it off. Went.
Will come back.
Yeah, and then everyone's saying you look like a child. So I was like, well, it's either grey or child, so I took the child option. Um, guys, I think the really interesting thing though is opening a practice. Now, obviously, you didn't know that COVID was going to happen because that got right in the way. Got right in the way, I would imagine, of things. But how was the whole kind of process of planning and then putting the plan into action, having people come in, contractors? What are the things that you didn't expect to be a big issue within opening a practice that came up?
But you can go
Want
first.
to start?
So it's a story.
Ignorance is bliss.
Let's have the story.
Ignorance is bliss.
Yeah.
Guys,
So
story time. Go get yourself a cup of tea.
Yeah. So we basically realized that, you know what, we need to do things a little bit differently. And it's senseless for myself to go out and open up in some corner office block alone and then wait for someone to basically refer to me. And I think as a specialist, especially in South Africa, we don't realize that general dentists are masters of marketing. Okay, so dentists are also expanding their practices in terms of their scope of practices, and patients are really unaware and uneducated about what a dental specialist is, or even they know an orthodontist because all the children need braces, which is why Imran wants to do orthodontics. But in general, they don't know what a prosthodontist or a periodontist does. Okay, and in practice over the years, I found that when a dentist doesn't know what to do with something, it's normally referred to a maxillofacial surgeon, irrespective of whether it's all a medicine or something. They don't know what it is. Go to the max fac because they know everything. But yeah, so I know it's a bit, yeah, maybe it's a bit wrong to say, yeah, but they do.
You said it.
Shots fired.
Yeah, no, it's fine. No, I have extreme respect for max facs. I mean, I wanted to be one, obviously, and the work they put in, things that they do in the hospital are absolutely amazing. Okay, and they are extremely well educated in all areas of dentistry, no doubt. Okay. But yeah, there are areas of dentistry which are, other specialists do exist, and it's time for the public to also know that. And the priority for us was to establish a business which has that setting, which we are able to market directly to the consumer and directly to the public, and also provide value for the referral dentists. So basically, at the same time as educating the patients out there, we are able to show the value to the general practices who are around us.
Yeah.
And yeah, thankfully, Cape Town has some brilliant dentists, and a lot of them do exceptional work. And they know and coming to realize that, these guys are around. And when there's something that is out of their scope or something that is a little bit challenging for them, they know that they have someone to back them up. And I think it's good value for their patients as well. So developing our team, it wasn't just overnight. Obviously, during campus, while we were studying, I always had this conversation with Riwan and other guys. Everyone just looked at me and said, we'll see. We don't know what's going to happen.
Yeah.
Then sometime last year, I think we were looking for properties and looking for stuff. And then initially we were chatting with our little group and saying, okay, we found a little property here, 50 square meters. Can we put one dental chair in here? What can we do? Maybe we can share the practice. And then we figured, no, man, I'm sure we can get something bigger to accommodate all three of us and actually make something wonderful from it. And I sent them a link for this property on WhatsApp. And then before you know it, we were all here together, standing inside, looking around and signing a document. And
It was the day before Ridwan's birthday.
Yeah.
Last
And
year.
it was Ridwan's birthday present. He wasn't even graduated yet, so we were still like, Ridwan, now you have to pass your exam. Don't mess up. Don't screw around.
Ridwan's never failed an exam. You didn't have to worry, right? He's not me.
I almost did.
Yeah. He got close. It was a tight one.
Yeah, you actually got a really good location as well. You've got again, I've been on Google Maps. There's like a big shopping area and things, so quite high footfall. Is that right? Yeah. So that's something that's really important.
This guy's like an undercover stalker. He's like done his background information on us.
I research everything now because
He's supposed to research.
yeah,
Doing
because
his job.
no, I did a lot of like off the cuff podcasts, within the COVID time, and to a lot of people that I never spoke to before. And you can imagine every now and then there'll be a guest where you just don't click and you don't know anything about them and you've got no idea about their specialty or anything like that, and it's just like and
How you
silence.
doing?
So it's one
Yeah.
of those. So
Yeah.
then, since I've moved to YouTube, I'm thinking, okay, quality is gonna go up. I'm gonna have something to say,
Yeah.
even if it's just to fill the sound.
Yeah.
um, but no,
Oh, we're quite fortunate to get this location here.
yeah,
So it's very close to Cape Town city center and with less traffic. It's a mixed residential and commercial area. And we've got the shopping mall like 2 minutes away. And there's a lot of
Lamborghini next
outdoor
door.
activities. Oh, yes, Lamborghini next door, and the hotel and the convention center all around us. And the big
Oasis
bank and
Retirement
Discovery.
Resort. Rizwan, is that where you get
Yes,
your
that's down.
patients from?
That's where he wants to get all his patients from.
But yeah,
Imran gets the patients.
Yeah, Imran actually gets more patients from there than us. Yeah.
yeah. But it's important to be in
They take
high
work to
footfall.
I'm
get
in good
engaged.
conversation with my patients. That's why.
Yeah, they can kind of sympathize and empathize with the grade.
Yeah, exactly. Exactly.
Or they remind him of their grandchildren. We don't know.
I say this, I'm going to lose my hair soon, and you can laugh at me then. But yeah, it's important because somebody else that we're going to speak to soon, we're going to have a couple of guys on, a guy and a girl. One guy from London, a girl from Brisbane, Gold Coast in Australia. Both opened up their own practices. She's opened up in the middle of a mall, and it's flying. There's patients coming left, right, and centre. He's opened up in a London area, quite close to like Canary Wharf and that sort of an area. The problem with him at the moment, unfortunately, is everybody's working from home, so the footfall
Yeah.
has dropped. Even though in a normal time that is the perfect location. So location
Yeah.
is really really key, unless you have some other way of bringing patients in. Obviously you need multiple streams of new patients. So I think it is really important for anyone who's going to be looking at any point opening a practice. You can't just pick up a building, out in the suburb somewhere if you don't have a plan for out in the suburb somewhere.
Exactly.
Uh,
So we were fortunate we have businesses around us as well as a lot of residences. So I think this local area within 2.5 kilometers, there's over 65,000 people who live here.
yeah,
So it's quite significant, and it's easy access from just about every area around Cape Town. So location, I think we were blessed, and yeah, we took over it was initially a furniture store for corporate furniture,
High-end
which went
furniture.
bust.
High-end furniture.
did you
High-end
keep any of the
corporate
did you
furniture.
keep any of the furniture?
No. So when it came to the design and contracting, we basically just went in flying. We drew it on paper, and then everyone made jokes
Good on
about
his
my
phone.
drawings on paper. Yeah, I made drawings and sketches on the phone,
Yeah.
and then they start laughing because my dental chair doesn't look too halal. Yeah, but
I'm gonna have to see these
yeah, I
drawings,
think we
please.
found no. We found a really fantastic builder, and so we shared with him our ideas, and I think he's a little bit of a eccentric genius in the way that he actually thinks.
Yeah.
And yeah, he put things together, and fortunately, he didn't. He basically managed to sort out all the problems for us. So he didn't phone us because he was missing a bolt or basically whatever challenges came through the building and the process. He basically sorted it through, and so he managed to complete the process within I think about 3 months.
Yeah.
Obviously, there was surprises here and there for us. Okay, I think when you have any project in building, there's going to be additional expenses. Okay, and you set on a budget, and your builder's imagination is set on a budget,
Like double.
and sometimes your budgets clash. Yeah, but yeah, thankfully, I think things turned out really well. The practice is quite different and unique,
Yeah.
not just from a chicken context, but I think in the world context. And yeah, we made the investments that we know we really need in order to fulfill our mandate. And as we grow, then we will look at investing in further technology which will enhance our ability to treat patients as well as be profitable. I mean, there's no sense in buying something for thousands of pounds or hundreds of thousands of rands, and you're only going to use it a few times a year. So whatever you buy needs to be a benefit to your practice. It's not like going to the toy store, which a lot of dentists I feel sometimes do. You'll go buy a laser, then you buy a microscope, then you buy some magnificent endovac and stuff, but you're not really using the thing to its fullest potential.
If you're not using any of those, I'm perfectly happy to take them off your hands.
Yeah. No, make use of it. Ridwan makes full use of his microscope. I don't know if Ridwan showed you his microscope mechanism, which drops down from the ceiling.
Oh, you got it on the ceiling. Nice.
Yeah. So we've got a
do you have a TV screen above as well?
No.
Do you have that little contraption?
Tell him about your microscope. You flip a switch.
Yeah, in my room when I had my set up, actually, I don't know if you can actually see. Let me move this. Let's see if this here is my tablet hold.
That is an awkward angle.
Sorry.
Yep.
You can see that I'm wearing shorts as well, so I'm wearing a
not underweight.
But the tablet comes on the left. The microscope will come over, and I use it for literally every procedure apart from extractions. But what's really useful is your nurse, when you're doing an endo or some surgery or whatever you're going to be doing, she can be sat on the other side looking across at what's going on and just hand you things as and when you need it, because she can see properly as opposed to peeking. You know how they put their head in the way sometimes if you have if they're trying to see what's going on to know what to give you. It gives them a really, really good view of what's required, and that's something that's been really, really useful. And obviously, the more they see, the more they learn, the easier it is for you in the future. So that's kind of how I go. Sorry about the angle there. Really, really key point about not overextending yourself with kit that's not quite needed. I'm sure there are guys who go out buying scanners and CEREC machines and then find they're not doing that kind of work or not doing it enough.
Exactly.
So yeah.
I think it's not about not doing that kind of work, because in dentistry you're gonna get that kind of work. But the second point of not doing enough of that kind of work.
Yeah.
Because I think it's all boiled. And there's a time. I think the other thing that is, in terms of the way, which is probably a discussion that the three of us have quite often, was in terms of what your practice needs to look like as well. You can say that if you moved into a new home, you can get your dining room set later and you can get your fancy flat screen TV a little bit later as well. But I think fundamentally when patients walk into a practice, they also need to see a practice that looks complete.
Yeah.
So there's certain components of the practice that you can build into later on, and there's other components of the practice that unfortunately just have to be part and parcel of your initial build. Because in essence, that is the face that you put out to your potential patients.
Yeah, I think they all feed into each other to give that kind of aura when someone walks in of what it is.
I still don't know how we built this place though. Like, if I'm sitting here thinking about it now, you think about the details that go into opening a practice. It's stupid. Like, you've got to think about electrical, IT, cabling. I don't know the first thing about IT. I don't know. There's a lot of detail.
Soundproofing the compressor and doing all these things.
Plumbing under the floor, lifting
ventilating.
the floor.
I think a lot of things you gotta just also leave to, you gotta trust professionals as well. You get some individuals that want to have a hands-on on everything all the time, but I think it's impossible to know every last detail about everything immediately, because you're coming from a completely ignorant background, and the longer that you take to actually get the practice going, you're paying rent or you're paying your repayment on loans, so it's costing you money. So you also kind of got to get things done. You start seeing patients sooner.
Yeah. What was the biggest thing that you guys came up against when you were in that process? Something that you're just like, wow, that was much harder or much more of an obstacle than we thought.
Money.
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 That's always the biggest obstacle.
There's always the biggest obstacle. There's never enough of it. You can't budget accurately enough for it. Yeah.
It's basically, remember, when you're doing these type of things, it's normally your life savings. It's things that you've
It
basically
is our life savings.
it's your life savings. You
Yeah.
worked hard for the time that you worked, and that's all you had.
Yeah.
And now, if things hit, shit goes down, you lose it all. But that's the risk that you have to take.
Yeah. And
And
how did you? I think what's really important there is you guys got it up and running, and then COVID hits. So how did you manage this kind of a situation? I don't want to go too much into COVID, by the way. Just very
Yeah.
briefly, how did you manage that area? Because I'm sick of talking about COVID.
it was an absolute
Every
shock.
single live stream we do, someone's asking, how do you think dentistry is going to be after COVID? It's like probably the same. I don't know.
Dentistry will move on. Don't worry
Yeah.
about that. People will always need dentistry. But I think COVID, it was quite a shock for us. I mean, we were just like traumatized, like, oh my God, we just opened. And remember, we have no baseline as a business. We have no baseline of what a month's supposed to look like. What
Yeah.
is an average turn? We have no numbers. It's just like we opened up, we saw some people, and we closed. And yeah, but thankfully, what we did do is we developed the practice with slow dentistry in mind. So we made investments in PPE and sterilization and our sterilization area, which is, I think, considerably more advanced than the majority of practice in South Africa. So we had all
Yeah.
those things in place. So during COVID, we could actively treat emergency patients. We had everything available, and even though we were sitting at home, if there was emergencies, we would come out to the practice, treat the emergency, set everything up, and then go back home. So yeah, and that's important. And we've also had, government did step
It's
up.
then I
in
just
terms of-
need to say this when you realize the importance of your staff. Because when you need to assist one of these guys, you don't know where how they keep their patience with these two.
Yeah. No, I think COVID was a blessing in some ways because Ridwan and and Imran, we learned our practice through and through. Because
Yeah.
now we had to do every single thing from billing to invoicing to running the compressor, water, everything. So that was our training, where our instruments are. Because remember, when you have staff and you let them pack everything away, you don't really know where everything is.
Yeah.
Now we
You
know
know to keep
exactly
track of
what we
everything.
have.
Yeah.
Yeah. So now I think it gives us a bit more control. We know exactly where everything is, exactly what numbers we have. And it's important to take stock of these things.
Yeah.
And yeah, fortunately, we had some relief from landlords and stuff like that. They get to delay rentals and they put half rentals. And yeah, so there was some assistance from, I think, in general to all businesses in South Africa. There was a little bit of room.
Yeah. A little bit of
I
leeway.
think also another big thing that you're speaking about the positives or the benefits of COVID. I think had this happened to us a year ago, it would have been a bigger tragedy because then you're a year into business and are you kind of thinking, can we invest in an intraoral scanner? Yes, let's buy it. And then you got a business that's running that now you've employed your full complement of staff. We currently had a so-called skeleton staff because we're a new business.
Yeah.
So we had a bit more cushioning. And I think personally for me, for him and Imran as well. So it also worked out to be a very decent networking opportunity for us because we ended up on some emergency dentist call out page. And I think from there, we ended up seeing quite a few patients who were not from our practice. And when we called those dentists back to say, hi, we saw your patient in lockdown, the patient needed this, we did this, please call this patient after lockdown for follow up treatment. I think that feedback was well received. So, in essence, it really helped with getting us to know our community and the community getting to know us. That I think very often you refer a patient to a practice that has a specialist and a dentist, and the perception is patient for life. And here, fortunately, the patient came to us and they got those patients back. So I think in terms of that, it was a huge lesson for us.
Yeah, you start off on the right foot with them, and that was something we were going to talk about, wasn't it? What the patient journey is through the practice. Obviously, you have the direct referrals, and then those patients go back to their original dentist, and then as I understand it, Imran sees the new patients and then directs them where they should be going. Um,
Pretty much.
yeah, and what kind of avenues have you been working on to get patients in the door? Other than the referrals, because I think that's the real difficulty when someone opens up their own practice. I know it's different for guys maybe like myself who are a little bit more Instagram and things like that. I have messages most days now, um, people from all over the place wanting to get treatment, but for anyone who's kind of starting from maybe scratch, I think you guys were a little bit more on the underdeveloped on social media side. Is that right? Until you started.
We had zero social media footprint, eh?
Zero.
Yeah.
Yeah.
Remember,
I
we
think
were
when you
studying.
specialize, yeah, when you're studying, you're not really interested in these things.
Yeah.
But
Don't
also, we're
really think
not
about
taught
it.
any of this stuff. Also,
You know,
we're
you know,
not
you don't
taught
have
anything
time.
about running a business or anything like that.
Yeah.
All you're
Yeah.
taught is how to treat your patients, nothing else. And then when you
Yeah.
finish and you
Same in
start
the
your own
UK.
business, then you're like, oh, there's so much other things we need to look forward to. I mean, we need to do and all that.
Yeah. And
I
look, yeah,
think
I'll
word
say
of
it, right?
mouth
I'm the oldest of
works
the
better.
group, but so we had no social media profile, and the reason is because we're a bit shy guys, and okay, you do your work and you go on with life, and while you doing your postgraduate studies, you're not thinking about. Yes, you're seeing Instagram and you're seeing Facebook pages with people doing fancy stuff, but you're not really thinking, oh no, I'm going to now just do that. First of all, I think when I was in first year at varsity, we had to sign a document that you can give your patient identities or any information online, because obviously you don't have consent for any of it.
Yeah.
So you basically go as an undocumented clinician for the duration of that period. And I think the only time you actually do show something is when you have a talk here or there to some dentist, or you go to a function, basically, where you have a little meeting, and that's the only exposure you really have. And I think we're also not, or myself, I speak for myself. I'm not the most avid speaker, and yeah,
Yeah, I think something like this is very different to standing in front of a room of 150 people and giving a presentation.
yeah,
Um, so yeah, it is a different world out there, I think. And believe it or not, if you ask someone who was, maybe in school with me or even dental school, I was probably the guy who was the quietest in the corner, just doing my own thing. Um, so I think you can learn it, and times do change.
You're still
definitely.
sitting in the corner. You're just chatting to people across the world about right now.
Yeah, yeah, I am very much in the corner here. Yeah, I think that's the thing, and then if you have this, obviously hopefully we will see you guys flourish when patients come in. How do you expect you're going to be able to manage the work life side of things, because you need time away, you need time to recharge,
Mm.
relax and rest. Are you guys someone who will do that? Go on holiday once a month, or you'll go, I don't know, you go to the gym or something. What kind of
A holiday
strategies?
once a month would be a dream, eh?
That's my thing.
Yeah, a holiday once a year, maybe. Yeah, that's currently where we're at. With COVID, maybe no holiday this year.
Yeah, that's a little spanner in the
Yeah.
works. But yeah, how do you guys manage that side of things? Obviously, two of you have young families, so that can be a very time-consuming endeavor. And then Ridwan, that's his,
You can start with Ridwan. He probably has
yeah,
the more exciting
exciting life.
Yeah.
two works.
I think before COVID, I don't know, COVID was actually bad for that work-life balance because the gyms were closed, social activities were cut off. You can't do anything. So I think for me personally, it became my lifestyle was becoming a bit unhealthy over the last few months because there has been no balance.
Mm.
And the easy excuse was I'm going to be at home doing nothing, so I might as well go to work. So I think but without COVID, I think generally I try to keep it balanced in some regard. Uh, whether it's being at the gym or running or cycling or hiking, whatever it may be. But then again, also, I think I don't have that much personal demands or commitments that's beyond me. So my lifestyle is pretty selfish, so to speak. I think for him and Imran are fighting the good fight and holding the
Yeah.
flag up high for the noble, hardworking men of this world. So I'm not the one that should be speaking about the work-life balance.
Yeah, I think for sure that these two are much more advanced than me and you. My work-life balance is talk to some people for an hour or two, and then watch Netflix till 5 a.m. until Fajr, and then go to bed.
Yeah.
Well, yeah, I think that's definitely a thing. You know, the lockdown has been very weird time because we had we had the whole of Ramadan within fasting. Um,
That
And then
was bad.
afterwards,
That was
yeah,
difficult for me.
I mean, you have more time to do all the things that you were supposed to do, but afterwards, my sleep pattern has stayed the same because I'm worried now if I try and go back to sleep at the normal time, I'm not waking up again in the morning to pray and stuff like that. So so I've just stuck it out. I'll wait till December comes and it's easier.
Easy life, eh?
Yeah. We have a comment actually from my friend. She's South African. Her mum says, I don't recognize any of you guys. So,
You know, South Africa is a big place. It's vast. I think
oh
it's
dear.
bigger than the UK. Considerably bigger than the UK.
Yeah, totally.
I think
Um,
KZN is as big as UK.
Yeah.
So basically, a province of two is probably the size of the UK
what's the,
or England.
I've forgotten, I did read this up, but what's the population in South Africa?
Around 54 million.
Similar to UK then. We're about
Yeah.
65, 70.
Yeah. There's a lot of undocumented and immigrants, and like there's a lot of people who are undocumented. So it's around 54 to 60 million. We're not sure.
Yeah, yeah. So I mean, let's talk a little bit more about South Africa as a place and the country because I think a lot of the guys who are going to be tuning in, there's going to be a few of you guys who've told friends and family and will be tuning in from back home. But a lot of the guys who will watch back will be from the UK, will be from the States, and South Africa is one of those places. I kind of before last week, all I knew was like Mandela. Kevin Peterson came and played cricket for England instead of South Africa, and then what else I know? That
Even,
Shabalala
even
guy
because
who
I
scored
think
in
he
the World
wasn't good
Cup.
enough to get into South African team, right? Is that guy?
That one,
Something happened
that's the
like
same
that,
one.
and then last week I did try and do a South African accent. Um, it didn't come out
We
very well.
don't have an accent.
Me.
There is zero. We have no
South
accent.
Africans don't have an accent.
So I did try and copy that guy who
Now
came into your
speaking.
practice. He was like a matrix dental specialist. That's not bad. Pretty close, right?
I don't even know what
I
country
don't know
that was.
what that was.
I
It was
don't.
Italian. Don't know.
That's my attempt. So for anyone who's been watching through, you can rate me out of 10 for that. Um, but yeah, how is South Africa as a country? I know you've gone through some difficult times recently, economically as well as COVID. How does it impact you guys within dentistry, you know, and within life as general?
Who's taking this one?
Dive in.
No, it's
It's like South Africa is two extremes. There's this
yeah.
really beautiful part of it, and there's an absolute shithole part of the population as well. There's like, I don't know. I love this place. I don't see myself living anywhere else in the world. Like, I really, really am passionate over this country. I really, really like it. But I think, like, I don't know whether it's like most countries or most African countries, corruption is probably the biggest demoralizing factor that we deal with. And then you got your middle class individual. I think, from what I know, for him and Imran don't have a huge trust fund waiting for them. Well, I hope that they don't because I don't. So, being middle class individuals who are trying to make it in life, when corruption happens top down, we are the ones that get most affected by it when it comes to taxes and interest rates and all of those things there. So I think that's the part that becomes does hurt.
Yeah.
Because fundamentally, the way our country is that you got 20% that's supporting the balance of the 80%. Uh, and like most developing countries, being the middle class becomes the most difficult. So,
But
yeah, I
remember, the
think,
stark contrast is also that, remember, the balance of that 80% are really good people. It's
yeah,
not that South Africa is full of crime and criminals and people trying to steal everywhere. The 99.999% of South Africans are really wonderful people,
Yeah.
and most part hardworking. But it's unfortunate that there's, people who are in certain positions of power who have now utilized it to capitalize for themselves.
Yeah.
And yeah, the entire country loses confidence, whether you're rich, middle class, or poor. And remember, as a middle class income earner, you're going to lose that opportunity because you're paying tax and everything. But we have to remember that there's a substantial part of the population who lives with nothing.
Mm.
And yes, they're given everything when it's time to vote. They will be given promises, and usually false promises. And they'll be given free meals, maybe build a house here or there, or a library here and there. But essentially, they get the bad end of the deal because they're never given opportunities to progress.
Yeah.
And that's the most
Yeah,
hurtful
it's
part. Yeah.
it's very similar, kind of everywhere. I think obviously I think it's more maybe extreme within South Africa because of the heightened inequality between the top and the bottom, right?
Yeah.
Yeah.
But I think the same thing happens. You'll probably say the same thing in the States when their election coming up, and we definitely had a bit of a farce in the UK, with the election that just went. I don't know if you guys saw much of that
Yeah.
in the news, um, which is why we're in such a bad position with COVID. Um, you elect a
Yeah.
liar,
You think you
yeah.
think you are in a bad position. You can look at
you're
South
in a
African
bad position.
economy, and then you'll know what real
Oh no,
bad
I mean
position you're
with
in.
Yeah.
COVID, the economy
Yeah.
is a whole other thing, yeah.
Yeah.
But
The
We
yeah,
just
COVID
had our
is
downgrade
yeah,
now.
very bad.
Like pre-COVID, our downgrade went through eventually, right? So now we sub-investment grade as well. So we're
mm,
pretty much junk. Uh, I think our other big problem is that with our history or the political history, that you had your political activists who were fighting apartheid, and when they now came into power, they have a lot of favors to return to their donors who supported them over the years.
yeah,
So that's the real problem because now you have a government who's in power who needs to look after people who were looking after them over the years, and obviously it's a financial return, and that's where you get all this corruption. And the thing is, it's not like the money is not there. The money is there. It's just that it's being not always poorly spent. The money disappears before it can even be spent.
yeah,
Uh, I guess, but that's how it is.
And I think a lot of South Africans just look at the current government. Basically, you look back and you say, these are the guys who bail us out of apartheid, and you have that trust that let's give them one more chance. Let's just give them one more chance. But I think eventually South Africans will get a little bit what we call gutful,
yeah.
uh, basically,
We've got a
and
comment. I
yeah.
hope your root canals are better than that accent. Wow.
I hope your root
Ouch.
canal's better than your accent too, mate.
Okay, that's me told.
The comment.
Yeah, make you some dentures there.
That's me told. Yeah. No, I think that's something that you kind of look at, and what was interesting was I sent you guys a screenshot of my my research, but the crime rate went down within lockdown because of this alcohol ban and smoking ban,
Yeah.
which tells you a lot about where the population is. Normally, when you've got alcohol abuse, it's because of again economic problems, people drinking away the issues. So it's very sad. But what I was happy to kind of see was there are guys out there who are trying to help within the dental community. So if you've seen Project Smile from Dr. Lex, he's done some great work. So I think there is a way that we can all get involved. Obviously, we know that we have got a privileged position as well, haven't we?
Yeah,
Yeah, that's
definitely.
exactly it.
South Africa has amazing NGOs who do phenomenal work, both from cleft palates and cleft surgery to dental and both humanitarian work. And I think we've got some pretty big organizations in South Africa who do substantial international work.
Yeah.
Like Gift of the Givers and African Muslim Agency. So we have guys who really do empower a lot of people out there.
Yeah, I think it's really important. Obviously, we had the 24-hour podcast that Mr. Pross came and joined us on, which hopefully we'll see you guys at one of those. Are you planning on coming out to one of the camps, Ridwan?
Right now, I'm stuck in Matrix. I'm not going anywhere.
There's a travel ban, so you can't leave South Africa.
He's been travel banned, or there is a travel ban.
There is
There's
a travel.
ban. There's a
Right.
travel
You can't
ban.
leave South Africa. Yeah.
That's Well, I think it's something that I'm looking at doing in the future. Maybe. Let's see if you guys are still locked in Matrix.
How
by
soon
then.
are you looking at getting that going?
I want to speak to Obaid or Ali to find out, but probably in a year's time or something. You know, when COVID's
Okay,
gone
yeah.
away. Yeah. Not
Then
anytime
it'll be
soon.
good.
Not anytime soon.
Good.
I barely left the house in the last 3 months, guys, which is why you can see my hair's been 6 meters long.
My wife cuts my hair. I need a haircut.
Yeah, no, I just wanna. I'm gonna let it go. I'm gonna maybe get it tied up, and then when we're happy to let me go back to a barber's, there's gonna be something to work with. Because the other way is you cut it too short, and then suddenly the case has all gone away. You have to wait. So you get it cut just on the day you let out the house. So that's my plan. Yeah.
Yeah, I couldn't handle my hair, so after 3 months, I called a guy here to the practice to cut my hair. I couldn't anymore.
How long did you get? Were you tied up?
It was about here somewhere, by the eye, into my ears.
Yeah, I've had mine really long before actually. I had it down to about my shoulder, which was
Yes.
pretty crazy. I don't know how the girls do it honestly, because you have to put like creams in and stuff like daily. So I learned a lot about hair. I'll not bore you all with it though. Guys who've been watching, can you drop any questions in for the guys? We're going to start to wrap up soon. I think we were planning on doing about 90 minutes. I think we had pretty good insight into who you guys are, how to open a practice, things that maybe you need to look out for, and of course specializing. Actually, was it worth specializing? That's a question that's an interesting question. Like all the effort that you guys go through, do you?
Don't regret it.
Yeah.
100%, yeah.
I think I've been hearing this question more and more from specialists as well, certain specialists actually. Do we need to specialize? Because you can go for some really good accredited courses or experience as well, and you can learn things. For me, I don't know about for him, but I still enjoyed specializing because you spent a lot of time just studying literature, reading literature,
Yeah.
learning how to critically appraise literature. So even because I think before specializing, it's very easy to chuck someone an article and say, this is how it should be done. But once you specialize and you start reading literature more often, you start critiquing things and not just believing everything that comes your way. So I think it's important to continuously be empowered and not just be self-taught, but actually go out there and learn from a very neutral type of standpoint. Yeah.
Yeah, I think that's really important actually, because to be able to critically appraise a piece of research, I think that becomes, because you could read an abstract, right, and go, okay, so if you stop X, Y, Z, then caries goes away. But what was the methodology that was used there? Was it flawed? That becomes very much the point, and you don't want to take away a wrong conclusion. Otherwise, you go on TV and you tell people to drink bleach because that's going to kill the virus, or something along those lines. So there are.
Yeah.
No one here's been drinking bleach, and just by the way, guys, don't drink bleach to kill the virus. It doesn't work. You may mess up your insides. Just as a disclaimer, just in case there's any kids watching.
You can use it for endos.
Yeah, you can use it for endos. You can't use it for drinking. Just to make
Not
sure
for
no one
dentures
gets it.
either.
Yeah, it bleaches the dentures, which is crazy, actually, isn't it?
Yeah.
Uh,
But yeah, any
yeah,
questions?
I don't think we had any questions. There's like 10 or 11 guys watching. If you haven't already hit like, guys, please do hit like. Um, but yeah, where do you guys see? Just before we wrap up, where do we see the practice going in the future? Do you see yourselves expanding, or do you just want to keep it as a tight knit group and see the patients that way?
I think we won't give that away yet. We still have to let the practice work
Yeah,
and get patients into the doors, push cases through, and see how things develop from there.
Yeah.
Remember
yeah,
that the practice is always something that's there, but it's something to enhance your life, and it has to enhance the life of your family. And it's something that needs to grow, it needs to develop, and it needs to go through with you through life. And remember, none of us can practice dentistry forever. You all
yeah,
need to retire. You all need to make plans for these events. And yeah, shit happens. And yeah, sometimes you lose the ability to work, and you have to unfortunately make plans for that.
yeah,
So yeah, I think that's an important area for young dentists to start planning for. When you start earning money, I think you need to start planning for how to save up for that eventual practice. And then once you develop into practice, how are you going to establish yourself, for your older age? Whether
yeah,
it's by employing associates, which I think is a very good investment because I've been one. And
So have I.
so, yeah, so yeah, uh, the practice doesn't end with dentistry.
yeah. I think that's really important actually because, like you said, or Imran, I think it was Imran. You said you come out of dental school, they only teach you how to treat your patients, and you guys are now running a business, and there was little to no direction on any of the things that you want to be looking at there. And I think it's important. It's an interesting question actually. Um, should dentistry be a career, which you have as well as some other investments, so that the financial pressure is taken off, and you can concentrate on increasing the quality of your work, as opposed to having to work to have money to live the life that your family wants to live, etc. Because that then puts you in a difficult situation. I think that's something that I'm going to definitely touch on in some of my videos, um, because it's an interesting conundrum.
No, definitely.
Oh, definitely.
I think
Yes.
also the other thing is, as dentists or as other healthcare practitioners, we can become a little bit self-centered with our existence. And I think there's a little bit more like Fahim touched on the family component, the retirement component. I think there's a responsibility that we have not just to patients but community. Like we spoke about the Refugee Crisis Foundation. Like that's phenomenal. Like we in a position, our career puts us in a position to actually benefit humanity in a way just beyond that's self-rewarding.
Mm.
I think it's important that young dentists also look into those things as well, because I think it's really a privilege to be a healthcare practitioner on any capacity. So I think whether there's dentists listening or whatever field you may be in, we need to also serve humanity, and I think we can't forget that.
Yeah, I think even for someone who's 1 or 2 years out, to have that experience of going out there. I've not been myself, yet, but having spoken to the guys the other week who have been out there, it changes their viewpoint on how lucky we
Yeah,
are and things like that. So then you can have a different appreciation of the life that you have, and actually maybe not be so heavy on yourself to keep on
yeah,
one
exactly.
upping, one upping, and one upping. Yeah,
That's exactly it. Because we spoke about our country and things, and I think perspective is probably a big lesson that I personally learned in this COVID time. That fundamentally we still have a car in the garage, we have a roof over our head, and we have food on the table. Like still better than most people in this country. So I think we
yeah,
just need to be a bit grateful for those blessings rather than focusing on bad business or business has gone down and those things here.
yeah, totally. And there's only Imran with his Lamborghini outside that's really,
Exactly.
really causing
If
some.
anyone
In
needs to
South
know what this
Africa,
is
the
about,
polo is a Lamborghini.
please go and check the video out on TikTok, and this whole joke will make
Yeah,
more
this
sense.
there's a TikTok video, or you post it on Instagram as well. So if anyone is very confused, Mr. Imran does not put his babies in the front boot of a Lamborghini to drive them around or anything like that. He has a Polo, so yeah. Yeah, but yeah, guys, any last words? I think we'll wrap it up there. I think we've taken your time. It's getting pretty late out in South Africa. Anything that you want to leave us with?
Come down to South Africa. You
Come pay us a
can
visit.
see what a beautiful place it is. Yeah.
Yeah, I'm up for that. I'd definitely be interested in coming out. I've not been to anywhere in the southern hemisphere southern half of Africa actually. I've been to Morocco and Egypt. I think that's about it. So it'll be something new for me. And you guys definitely need to come up north to England once all this corona's gone away. I'm sure we'll find something to do. Guys who've been watching, thank you. Please hit the like button, subscribe if you're new. We have plenty of things coming out. There's going to be a new series on how to be a dentist on Instagram, how to use Instagram for dentistry. So I'm going to be going through a lot of things there. It's probably one of the only things I do know about. We're also going to be doing possibly literature reviews, so that's going to be something that could be quite interesting as well. Still in the early stages of that. And also make sure you guys head over to the Instagram and follow Matrix Dental Specialists. We've also got Century City Dentist, RH Proso, and Perio Vision as well. So those are the guys' Instagram tags. I will add them into the description below. Here is a little view of Matrix Dental Specialists waiting room.
What do you expect him to do?
He's giving them a tour.
I can't give them a tour. I'll have to stand up and walk around.
And thank you to everybody who's on the Patreon. You're the guys who are sponsoring the channel. If anyone wants to help me out and help improve the quality of these videos, Patreon's where you can do that, plus one-on-one tutorials for Instagram, etc, etc. Have a little look over there if you're interested. Thank you all for joining us, guys. It's been really fun. I think we're all getting a little bit weary now, and we'll